We are here for things nobody tells you, and this time we're talking about labour and birth, and I'm here with my very good friend Lauren Severiano, even though I never pronounce her surname right. But Lauren is a nurse and a doula, and is that previously in the US you have played a similar role, obstetrics nurse?
Yes.
Yeah? So I'd love for you to share a little bit about your journey from what you were doing in the US in supporting women with the most important part of life, which is giving birth, to what you're doing now.
Yeah, I've been a nurse since 2012 and worked in labor and delivery for about 6 years in that time, primarily doing the clinical bedside work, all the things that midwives do here in terms of when you go into a hospital and you're cared for a midwife and throughout your labor. I was doing those things. We just have different roles. So coming from sort of the obstetric side, that's how I learned about birth from the start.
So
and
very medical.
Very medical.
Yeah.
And also very mechanical. Like we look at birth like this is the textbook and very linear. This is what happens. We're in stage 1. We're in stage 2. We have dilation and like numbers and facts. And
you're going to
deliver. They love the word deliver.
Deliver a baby.
Love the word delivery in the US. That's how I learned about birth. Even as I had my own kids, I was a nurse in that way. And so approaching my own 2 kids' birth, I didn't even really realize all that it really encompasses and the experience of women that it encompasses.
I usually do throw a question out to people when we start this and say, what is, the thing that no one told you about labour and birth? Would you say that, it was quite a shock for you going through birth, quite different to, being a medical professional?
Definitely. The thing that I didn't realize about birth was how much more it is than just the physical process and how much going through that journey from a mental health standpoint, from a spiritual, emotional standpoint, how much that actually still is involved, whether you consider yourself a very spiritual person or not. It's a kind of experience that we have, that we get to have opportunity as women to experience and go through a big transformation. And as a young mother and also an obstetric nurse, I never really focused on the journey. I only was just thinking about the outcome, which is generally, when we're coming from a medical perspective, we tend to only think about that. So we think of birth in this very predictable, linear, textbook-like process. And not just a little bit, it's a lot more nuanced than that. It can actually be very, very simple, or it can be just infinitely complex. And the variables that make it complex or different are as unique as every individual. So even though I've been to over 300 births, like every birth, even though we're doing the same thing, is a little bit different. Yeah. And I learn lessons about how women labor each time. What I found in being a doula is how actually important the role is. From just that, the traditional role of a doula is that it comes from just in support. So support, helping you manage and cope, that mental, emotional support, which I feel like sometimes is disregarded by society. Like, how important can emotional support be? Well, the answer is it's everything.
Yes.
It's everything. Because the mind is so powerful, if you've got a woman that feels well supported, feels safe, the labor will keep on going. Yeah. And as soon as you get into a situation where the woman is suffering, we're behind sort of the mental curve, lots of self-criticism comes into play. Like lots of, just coping mechanisms that they've done as a child. Like those things begin and show up in the birthing suite. I've also learned infinitely more about spontaneous physiological birth than I ever learned about that as a clinical provider in the hospital, because quite frankly, it's not well supported in the hospital. And the tendency is we value certainty and predictability. So the interventions that are suggested are often suggested in order to predict timing, efficiency, and to really feel that they want to control. Like it's all about controlling these variables. The operations and the logistics and the needs of the hospital begin to surface. Yes. And then this affects organic, spontaneous labor.
And also how you feel seen and heard, because I know I had one, and I don't want to make any judgments on certain scenarios, because I know there's so many layers to this. I had private experience to public, but with an obstetrician. And there were so many times I thought, gosh, like, why haven't you rung my obstetrician already? Or why are you taking so long to get the epidural? Or why aren't you listening to me? And it almost was that I was kind of stuck in their routine and their process, and they had that control. And I felt absolutely no control, which ultimately made me feel worse. I didn't feel like I had any control over what was going on.
But even if we talk about languaging where we know that the woman is fully dilated, okay, there tends to be languaging like, okay, we'll let you labor down for an hour, or we'll let you sit around to have passive descent, and then we'll start pushing. What I didn't know about birth all this time of being 6 years a nurse and until I became a doula was that is not necessary.
Yeah, wow.
Like, how about we just go with what the woman's feeling?
Yes.
And it will happen. Like, the woman will have a sense that she doesn't even have to actively tell herself to push. Her body will do it.
And is that because they want to control the production line of who's available there to help with the delivery? Like, why would they get someone to labor down? Or
I think mainly because in their mind, there's many different research studies and they look at all the timings. They're concerned about ultimately like having a hemorrhage or something like that.
Got you.
So they have these time parameters that they think, okay, we need to get women moving along. We don't have a prolonged second stage. What I would say is when it comes to a woman in physiological birth, which means everything is happening within their own power. They're managing and coping with the labor on their own power. There is, there's not an epidural on board. There's not a drip running. So if everything is progressing naturally, some of these things, these time limits are hard to put those time limits on because the majority of labors have epidurals on board, have things that have changed and altered the physiology.
I was like, get me on my back, give me an epidural. I'm not prepared for this stuff, just help.
When you have these variables that hugely change how the labor is going to unfold, it's kind of hard to put like, well, all pushing stages need to be within this type of time frame. Yep. Well, why is that? We have to break it down more than that. They'll write the policies to give guidelines, to set parameters about how long is too long and all those things.
My gosh.
But if we can stand in the possibility that if we've looked at it like the whole picture, that the baby's okay, the mother's okay, then can we step out of it and have her show us when it's time?
And is that something that you come up against now that you have an idea of what it looks like on both sides of the fence? If you are feeling like you're working with a client and they're going through this natural stage and you feel like they're trying to push her into something else, is that where you step in and advocate? And how does that dynamic usually work?
Before we even get to birth, I've met with my clients at least 3 times for at least 3 hours each time, because we go through a sort of base knowledge about all of these standard interventions, when they would be offered, why they're generally offered in a standard way, and how to know like when it actually is like makes sense for you to accept that recommendation. So we've done a lot of groundwork ahead of time. By the time we get there, we have our game plan in terms of that. When
not a birth plan?
Not well, yeah, kind of. But it's more of like, I take it of the role that in terms of being a doula, I will be an advocate, but not in the most direct way. It doesn't help her or anyone for me to get in and be a bulldog and no, you can't do that, and be argumentative and confrontational. I don't think that actually is helpful. No. Plus, I've been them, so I know what they're thinking and how they have to work with the pressures of the hospital system, with the players in the room. I understand those dynamics, so I look at it more like, what information does my client need to know to help make her have a decision,
to empower her to be able to say what she...
The other thing is that I don't really want to step in and take her voice away from herself. I really believe in self-advocacy, and I try to help find her voice. So what that means is, if I can sense that I don't feel like they're telling all of the story, I'll just continue to ask more questions where I feel like they will get all of the story. When it comes to needing time, I'll ask for space. I'll say, can we just have a few minutes? And then everybody's like, sure. And they'll step out of the room. So I really try and say, okay, do you understand everything that has been presented to you? Do you understand why? And we make sure that we kind of go over the understanding together and we kind of brainstorm options. And then when it comes back to the provider coming in, we can ask about those alternatives that we kind of talked about. And it ultimately, I'm relying on my client to really feel like, and giving her the space to tap into her higher self. And because I really do rely on her instinct, and I really believe that she's the expert on herself.
Yes.
And so everything that I'm advocating for is to help to continue to encourage her to listen to her instinct. And that ultimately she does know best. And if she doesn't know, how can we get more information to help her make that decision?
And do you think a lot of that is based on the prep work that you do? Because I think I was not trusting anything that I was thinking in that moment. I was like, just tell me what to do. But now in hindsight, listening to yourself and, Nadine from Sheba, so all of these people I've had access to, I'm like, wow, I actually really could have done with somebody in my corner explaining those situations. But do you think for her to trust her instinct and to her to respond that, it was important that you do that groundwork? You're saying,
definitely,
all of these sessions beforehand. And what is that typically? It's the options that she's made aware of. I mean, because can you really even plan for
Right. It's definitely a balance. How well you handle the tension of this paradox of, on one side, you're going with the flow. Like, you're trying to be open, you're not being too rigid on anything. And so as a result, you decide not to prepare about anything. And then things might happen that you haven't had a chance to really absorb and really think about all of the implications to make a fully informed decision, and have to deal with sort of the aftermath of it after. Or the alternative is to research everything, finish the internet on every single possibility of what could possibly happen, and, try to get essentially a medical degree yourself to try and figure out how you would not handle it. That tends to be a lot. If being that rigid can make it hard to let go and make it hard to feel safe.
I remember seeing in the birthing classes, the ones that were writing every single note down, and then there was Sabir and I looking at each other going, did you get that? Oh, shit. And I was thinking about something else. We had no hope, really. But I always think back to that moment that, yes, some are so prepared, and then, some fly in there just, I'm going to go with the flow. And I guess there is, there's no right or wrong way. However, that surrender, I think, or letting go, like you say, is something that a lot of people are going to have to do in some way or another.
Everybody has to find their own balance of preparation and of resilience and ability to pivot, to be flexible, not to where you're compromising like core values and wants and needs, but to be the point of still feel empowered, like you still made the decision. Like you didn't go into your good girl complex and just acquiesce and say yes, but that you actually
be a people pleaser and just, okay, I'll do what I'm told. I'll shut up. I'll just,
So
is that my problem?
It's just we have to figure out how to balance. And so the birth plan, I am a big advocate for birth plans, but not in a way where it's like, here's my birth plan, here's a list of all my wants, and I'm not going to be rigid, and I'm going to be rigid, and this is what I want. What I want is what I want.
Tick them off and just do what I want.
But I am a fan of them because, when I used to be a nurse and a woman came in with a birth plan, I'd be really happy because I knew that she visualized her birth.
Yes.
Like she walked through it and she really thought about every component, and I really appreciated it. And I also saw it as a way it's a piece of self-advocacy. This is who I am. And before I get into a place where I can't speak for myself, at least I have these things written down. And I also see it as a really good point of communication with your care provider. Like I always recommend talking about your birth plan with whoever that is. Even if you are, seeing like midwives at the outpatient clinic, I still recommend, even though those midwives are probably not going to be on the ward when you get there, that you talk about it with them. They document that you spoke about it. They put your wishes and needs into their notes system so that every care provider after you has the opportunity to know you a little bit further and more before birth. Yeah. And then when you get to birth, you bring your birth plan. It's an easy method for communication for changing staff. So they don't have to keep asking you all your preferences. They can just read it right there. With the birth plan, also, I recommend to my clients, how are you going to plan in a way for you to be resilient, for you to pivot when you need to. Sometimes there are things that you just cannot control.
Yeah.
So how are you going? What's your plan of how you're going to handle?
Don't go to plan.
Exactly.
I would love to touch on, obviously, the things no one tells you. I've got some sort of quick fire topics that I would love to explore with you.
Okay.
The pooing in labour. Can we just talk about that for a minute? Because I was terrified of the idea, and it was... Sorry, too much information for our poor producer, Rich, over here. But I remember having a look at, so my mum was present at my Ishk's birth. My mum was present at Ishk's birth. So she filmed it. Thankfully, there was a big light down there, so you couldn't really see, but you could kind of see and you could hear what was going on. And I didn't think that I pooed in labour. And it wasn't until recently I was looking back through the video, I was like, oh, what's all of that? Oh, maybe I did it. I didn't know. And I was mortified, the fact that I didn't think. Like, I was like, are they just very good at quickly scooping it up and whisking it away?
Yes. Yes.
So it's obviously quite common.
It's very common. Yeah. I mean, I'm
same
not
muscles, I'm guessing, to push a baby out. Essentially,
especially if it's happening, then we know that the labor, that the surges are powerfully moving that baby down, and it's making space. And that's just, and the seasoned midwife will just swipe it away. You won't even know. And honestly, we don't even see it. So it's hard to, but if I could encourage you to not be worried so much about that, because we don't even think of it as the way, like you might think of seeing someone, pooing. Yeah. You wouldn't think about it. We just go like, okay, that baby's moving down. And another thing is vomiting. Like when it starts to get like those surges are strong and they're taking over, and you just kind of feel like, oh, it's coming out this way, it's coming out that way. There's nothing you can do.
Yes.
It's like, it's a reflex. So like, it's just like, okay, if anything, I mean, it sounds awful. And of course, if it's not a pleasant experience, but when I see that, I go, oh, the labor's really cracking on. Yes. Like we're kind of, birth workers and doulas, we're all kind of like looking for the intensity. And so when we see it get intense, we're like, yes,
here we go. And I have heard things like, you'd mentioned vomiting, but also shaking uncontrollably. Shaking uncontrollably also can happen as well.
Yes. So particularly when you hit transition, it's about the different hormones that are like all firing at that time. And when you get really close to the end, the body knows that you're about to have the baby, and will start a surge of adrenaline will start firing, and that's the shaking. And that adrenaline gives you the energy, the superhuman energy to push that baby out. And also that adrenaline passes to your baby so that your baby can be quite alert and engaged with you and be ready to feed. So it's nature's design. And so, but sometimes that shaking is quite like real, and you're like, oh, I'm not cold, but I'm shaking.
Not cold, but I'm shaking. Yes, I've seen that.
Yeah, that's the natural hormones that are supposed to be happening at that time.
Let's talk about that for a minute, because I didn't realize that you had to give birth to the placenta as well. I sound like I was very naive. I was very underprepared. But I think in my first situation, I'm going to say it wrong, I had vena previa.
Oh, vasoprevia.
Vasoprevia with Ishk, which I had no idea. And I remember, going through this, like, she's come out, she's on my chest, and I'm like, what's happening down there? And there was lots of blood. And, he used to be wanting me to talk to his family on the phone because I've just given birth. I'm like, get the phone out of my face. Like, I'm just like trying to deal with whatever's going on. And I had lost a lot of blood, but then, I had to give birth obviously to the placenta, and I could feel them sort of pushing it out. And that's when the obstetrician said, oh my gosh, like, have a look at this, and explained exactly what that was. So I think despite your preparation for how, it's all going to pan out, there are these surprises that can still happen at the end.
Yes. Yeah. Well, and the birth is not finished. The baby's out, the birth is not finished. Let's not get on the phone and announce the baby and all the things.
Get away.
FaceTime with the grandparents. Like, let's just wait till the placenta's out.
Yeah.
And so, yes, there's two different ways to manage with the placenta, like physiologically, which would means we just let it come out. Because there's an argument to say that if you had a physiological birth and all of your hormones are like firing, right? You're secreting the most amount of oxytocin at that moment, especially with the baby on your chest and you're in love with your baby and that love hormone is just firing. That is the hormone that is helping the placenta to detach and hopefully control for bleeding. Okay. If there is excessive bleeding or if the physiology was interrupted in a certain way, then it is, more to your advantage to accept the active management to help control for that. But the active management is just a shot of that synthetic hormone. Yes. And so then it helps the placenta detach. And when the placenta comes out, then the uterus can sort of close down and clamp off those kind of open blood vessels to stop any bleeding. If all is well and there's no excessive bleeding, then
you can just let it come out in its own time. Is it?
A woman could choose that, basically. Many people still choose the active management because they just want the birth to be over at that point.
Yes.
And baby's out, so
they just want to kind of.
But there are many of those like, nope, I've done everything on my own, in my own perfect balance of hormones, and that my hormones are going to protect me. And so they choose, and the skin to skin, the breastfeeding, the baby suckling of the breast, that's all going to help continue to secrete your own endogenous oxytocin.
Oh my gosh, yes, the cramping of the tummy when you're feeding. I did not know about that. I'm like, oh.
And particularly with your second and third babies, that tends to be stronger.
Yeah, it is. It was stronger.
Yeah.
I do remember that. And what is the latest research, I guess, on, skin to skin and putting the baby straight on? I mean, Ish came out with a hairstyle. She had Liza Minnelli hair, I tell everyone. And so they did have to wash her up a little bit because, again, lots of blood. Am I scaring anyone by saying this? But they had to wash her hair.
Yeah.
But then I was very adamant about obviously having her on my chest straight away, and they did let that sort of happen first. But yeah, is it that we are encouraging, baby straight on there?
Yeah, baby straight on there. The baby will. It is probably best for the baby to be straight on the skin to help their own transition and their own nervous system regulate. They smell you, they can hear your heartbeat, they can hear your voice, they feel warm by your skin. All of that is helping the baby transition. So the baby is born and comes on the chest. The best place for the baby to be to transition sort of to extra uterine life is with the mother. And from the smells, the warmth, the heartbeat, the sound of the voice, all of this contributes to regulating the baby's nervous system and blood pressure and heart rate and blood sugar. Okay, so all of that keeps the baby more stabilized. So the old days of like immediately clamping every single baby and taking the baby off to the resuscitator, it produces it's stressful on that little baby. And so, staying with skin to skin and the mother is actually going to be better for the baby and better for the mother. So because, again, the mother is hoping to control, like nature is going to control for bleeding and needs that extra boost of oxytocin that you get when you stare at your baby and you go, oh my gosh, I love you so much. So both functions are important to help each other.
I find that so fascinating. And is it that they don't cut the cord then as soon as what they used to? Is that what you're saying?
It's generally agreed upon, actually, that delayed cord clamping, waiting at least a minute, 1 to 2, is generally widespread. Obstetricians, everyone believe that is actually beneficial because it allows for a lot of the blood that's still circulating the placenta to come back to baby. And so the baby has a higher blood reserve. The question is what's optimal? Yeah. And optimal cord clamping, it would be to wait until it's completely diffused over to the baby and the cord is turned white. Yeah. And the cord has stopped pulsing, and furthermore, the cord is turned white. So the baby's gotten the maximum amount of red blood cells, iron stores, antibodies, stem cells, all of the things that are helpful, and that the baby has a higher oxygen carrying capacity. It's really quite remarkable.
It is remarkable. I was just worrying about whether mine would get an innie or an outie. And there's so much more to it. Yes. Sorry.
That is genetic, by the way. That's all determined.
Is it?
That nobody ties anything.
Are you serious?
It's completely genetic.
Am I the only person that didn't know this? Am I actually completely stupid?
So the clamping of it, then it's this debate of like, how long should we wait? And again, the more on the physiological birth you're leaning, then you want sort of all of that.
And you can push for that, right?
That's where like all of those, like that's where that birth plan is really helpful, especially if you have a provider that doesn't lean that way. Many OBs I've seen, they're like, oh, well, you really don't need to worry about anything beyond 2 minutes. And there is some research out there that says the majority of the blood does happen within that time. But hyper focusing on one particular research study is not going to be helpful in understanding the whole context. And then it's the woman's choice. Yes. Like, it's her baby, it's her placenta. Like, there are reasons that you can't wait. If the clinicians feel like the baby's in significant distress that requires resuscitation beyond just putting on the mother's chest, then
and
of course.
That's obviously a decision for,
That's a decision for your care provider to, the skill and to determine and how to assess if that baby's really well. But that doesn't mean that you can't make your, like, I would prefer to wait. And if all is safe and well, we're going to wait.
And what about the crawling to the boob? Because that is something that's pretty fascinating. That's why we've got really nice, big, dark areolas.
That's it.
Because the baby needs to find them. But again, I find that fascinating.
Yeah. I mean, they have actually categorized, there's 9 instinctual behaviors that the babies do if we just let them be.
Can you tell me?
I can't tell you 1 to 9 because I can't remember it all, but that is more for a lactation consultant. But yes, I do know that the breast crawl is like everything comes from, it's like cooing and crying and looking and like they've categorized it all.
Wow.
And
well, we are doing an episode on boobs and bottles with the lactation. I'm going to be.
Oh, definitely ask them about that. Yes. But the idea is to know that this can happen, but we need to allow the baby to do it.
Yes.
Because a lot of times it's like, oh, okay, the baby's out. Okay, well, come on, darling. Here, put the baby out.
I like letting them try and find it.
Yes. And like the not giving a chance for the baby to explore and imprint and sort of teach themselves. It's just about exploration and learning, and they're hyper focused and from learning on it. And I think we tend to be like, well, we got to get the baby on the breast. They've got to feed within an hour. We've got these metrics we have to make. And really we need to, in that sense, be really guided by the mother and the baby working together. And it's their first meeting, and to rush it, the baby may not be ready to feed. It might have been imagine being a baby coming out into the world, just being squeezed out. And you're just like, a lot of times you look at these babies and their eyes are wide open, but they're looking at you like, what was that? What just happened? Sometimes they need a minute to gather themselves in their own baby way. So let's just see what they're up for and, allow them to show us that they're ready and allow them to learn. And it's quite remarkable when you actually see the baby making their way and latching themselves. It will happen if we just let it happen.
Now, obviously, when these babies come out, they can have all these weird quirks that you are not prepared for. Swollen genitals comes to mind, which I freaked out about. I was like, what is going on there? Rashes. I mean, what are some of these kind of typical things that you might not expect?
Yes. So sometimes, babies, they can have quite significant molding that comes out depending on how they come through the pelvis.
I apparently had a cone head.
A lot of times you'll see those sort of cone heads if they've been sitting in that vaginal canal for a while, or if they were like posterior where they're where their back is to your back, and so their head will kind of come up there. So it gives us some clues about the positioning, or if they were what they call asynclitic, where they're kind of their head was to the side and it might be uneven, or so. All of that molding is the baby's head is purposely not fused so that it can get through the birth canal. So it will actually correct itself in a matter of hours. In 24 hours, it would be different. Like they will also might come out with like the swollen genitals, or sometimes they'll, like young girl babies will have like kind of a pseudo menses where they're seeing like sort of blood in the diaper. And that is just either the swollen like genitals for boys and labia for girls. That is just because of the mother's hormones. And they need to sort of filter the mother's hormones out. So the hormones are passing through the placenta to the baby. So it takes some time for those little labia to kind of go down. So it's totally normal.
Could be quite a shock. Now, I had a jaundice baby. I feel like I've had everything. Tick, I've had cone head, I've had jaundice, very yellow. I was like, oh, good tan. Being half Indian babies. Yes, got nice tan skin. Okay, no, it's a bit yellow.
Yes, so jaundice there's sort of normal physiological jaundice, and then there's, where jaundice is a problem, there is some type of pathophysiology happening, but it comes from the breakdown of red blood cells, breaks down ultimately into a chemical called bilirubin. And that bilirubin, especially when unconjugated, kind of floats around in the bloodstream, and then it's that yellowing color. And the way we get rid of it is by pooing it out mostly. Okay. And then also an exposure to light, it helps change the compound so that it's not so worrisome.
Right. And from memory, there's a scale.
There is a scale.
Measure it, and then
there's a scale, and it goes on this curve based on how many hours old the baby is. Okay. And there's a treatment line. So then at some point above the treatment line, then they just worry about the risk, and the risk of too much bilirubin. You can start to have neurological effects. So it starts to affect the brain. So they have a scale that's a threshold that feels like the babies are able to. That's a normal amount, but then they start to look at, is there some other process that's causing these breakdowns of red blood cells versus just what is sort of in the normal range.
There you go.
Yeah.
Next one, rashes. They
come
out sometimes.
Yes. So newborn rashes are very, very common. Almost kind of looks like, some weird kind of acne or, skin that it kind of comes up, and that's just all part of the normal realm, like as the baby gets adjusted to the air and the humidity in the outside, and the skin kind of needs to sort of come back into regulate itself. We've never had to do that before.
Right? Absolutely. Baby pimples is very weird.
Yeah.
Extra digits.
Yes.
And again, it's something I don't commonly talk about, but one of my children, and I'm not going to say who, one of my children did have extra digits, and thankfully, and I will say who it was, thankfully it was my third baby. And I always say, I remember when she came out, Sabir goes, oh my gosh, what's wrong with her hands? Thank God it was my third baby, because if he had said that with my first baby, I probably would have spiraled. I probably would have really freaked out because it was such an overwhelming thing. But she had extra digits on either side of her hands. Now, it could have been linked to her genetic condition, but I have heard that it is quite common.
I mean, you can get extra digits or skin tags, and it's all part of the assessment that the midwives do. They're looking at 10 fingers, 10 toes, but it doesn't necessarily mean it's something a bigger issue than it is. But that's where the pediatricians will come in and they start looking at that. But
you said the 10 fingers and 10 toes, can I say? Because we actually kept it discreet. We had mittens on her even though it was hot, because I didn't want to tell anyone, because when I was growing, and I'm quite open about everything, but I remember being when I was younger, a friend's cousin had extra toes. So he was always known as the kid with extra toes. Yeah. And I never wanted her to be known for that. Yeah. So I kind of hid it and had it in little mittens, but someone made the comment about, as long as she's healthy and got 10 fingers and 10 toes. I was like, kind of. We had to wait till she was 6 months old and have them removed in surgery, but that was our choice. But the 10 fingers and 10 toes, it is a thing, and it
does happen.
Yeah, and I feel like it's just, it's not that you should be scared about that happening, but it's just knowing that you're not alone. It's not.
Yeah, absolutely.
Yeah. Now, I know that we don't want to freak anyone out about all these weird and wonderful things with babies, because some things you just got to find out for yourself. But for the mum, I must say, that first poo when I got out, going to the toilet, and they asked you, have you been to the toilet? And I'm looking all around me at these posters on the wall going, oh my gosh, like what? Like, this is terrifying. I mean, what are some of the things that people are often taken by surprise with when it comes to, their recovery?
That you will probably bleed for a while. And, that you, some women bleed more than others. So it's hard to, when you start talking to your friends about it, you gotta remember that everyone is different and has different biology and process in that. I think it's important to like really go slower than you think you need to go in terms of recovery. I don't think that, I think there's a big rush to be like, okay, get up, get back on your feet, get going. And I think we might take away the time that actually we just need to sort of recover, that we do just need to kind of lay around and
get to know your baby as
well. And exactly, be with your baby.
That was my favorite thing, was to bunker down and not have guests. I was really horrible. I was like, no, I don't want people to come over, because for me, I just wanted to be there and surrender. That and you're so tired that you kind of don't have much energy for anything else, and that's okay. And so I wouldn't worry too much if it's like, oh, this is so hard, I'm not doing enough, and like, but let's turn that and let's reframe that, and then like, I'm doing what needs to be
this
done.
is what needs to be done. And the extra stuff that we think that we need to get to, that's why you have to have a really good postpartum community around you. Like, you don't need to do it all. You don't need to worry about dishes, laundry, figuring out dinner for their other kids. Select someone before that, before you get there.
Because I hate having to deal with food.
Or figure out your plan for your postnatal meals or whatever.
But I've seen some of the things you take to your clients. I'm like, oh, Lauren, can you cook for me too? So just focusing on the wholesome, the healing.
Yes. And just like, you don't need to do too much too quickly, and give yourself a lot of grace. And the hormones will be flying. You will, all of a sudden you're in, those tears might come as you process what you just went through. Those tears might come as you feel frustration with, if you have a difficult breastfeeding journey, and then you feel bad that you feel frustrated, and then it's just like this cycle. So when you're spiraling like that, it's really important just to pause, take a breath, find someone to talk to, and so that you can release those feelings and have a good cry, and then you're usually able to, that might help reset you. But if you're judging yourself for having those feelings, then you're kind of just perpetuating your spiral.
Absolutely. And I just want to say something, because you mentioned earlier about the baby and on your chest and all the rest, but some people don't fall in love with their baby right away. So I think, just as you said, like, you can't judge or feel bad about the way that you're feeling, that sometimes it is just going through those motions and knowing when to call on help or speak to someone. Yes.
And I think that that's where hopefully you have a support network, your partner, your family, whoever is also looking after you as well, and looking out for those signs but getting you the mental health professionals when needed, and reaching out if they're like, going back to your medical provider, even if it's before the 6 weeks of postpartum, because a lot of times they're like, see us in 6 weeks.
Honestly. And everyone should go and see a women's health physio.
Absolutely.
Can I tell you? I say that and I've still not been, which is why I can't drop on a trampoline. But I do tell everyone that's what you should do. It should be covered, because that 6-week check is just as much about you as it is your baby. And it's not about you just being able to exercise again or whatever it might be, that actually there might have been some changes. Yeah.
And even if 6 weeks is too long, like, cause you're really struggling with all of the feelings, the mental health part. And we're thinking this is more so than just typical hormone fluctuation with baby blues, but actually you're feeling like you're afraid to be alone with a baby, or you're feeling very, very withdrawn. Yeah.
There are so many great helplines.
Then it's about reaching out sooner and then really addressing the postnatal depression possibility, and really and activating the resources that are out there.
Yeah, lots and lots of resources available. If only everyone was as lucky to have someone like you in their corner. As I said, I'm not going in for a fourth baby, forget it. But had I have had you in my corner, I feel like I probably would have had 3 very different birth experiences. So it is very important work that you're doing, and I just love how you have such insight, not just from the medical past, well, actually, you're still a nurse. You still got that, but also now from a doula and empowering women to have the best possible births, which I think is pretty incredible. So,
and can I just say though, one other thing, just about doulas, they are non-medical birth professionals. They know a lot about birth and they're well informed, and I'm, but I always really try to come down to that. Of encouraging my clients to ask questions, but not giving medical advice. I will share the information that I know, but it's really, really, really important that you also speak with your provider and about making specific decisions to you. So,
Absolutely.
And any doula that sort of operates in a, I'm giving you medical advice is is operating sort of outside of their scope.
Yes.
So
it's important for people to know their roles, and that's something I have learned from you, that you very much own and be within that, of what you're actively doing there, because yes, you're right. There's midwives, there's obstetricians, the doctors ultimately have that responsibility.
They do. That's their role. That's their charge. I think my role is to just support the women in their decisions and helping them understand what options that they have and ask more questions of their medical providers.
Yes.
But that ultimately it's their decision, and I'm there to support them.
Yeah. And even when there's a partner, sometimes you never know.
Yes. Although doulas are very helpful for partners too. A lot of times it is about reassuring that this is normal, because they're seeing their partner in a state that they've never seen her in before. Yes. And it can be quite disorienting and also worrying. Yes. When a woman is really in active labor, she's very much going within and interacting less and less, and saying less and less words and making all kinds of sounds. And
that could be terrifying.
It could look like she's really, like she's in pain, and she might be in pain, but it could look that she's like really suffering.
Can I just say something really funny? Is that when I was having Zarik and I was stuck on the side of the bed, and I looked up and there was a mirror in front of me, and all I could see was to be scratching his head. He looked like he was about to have a nervous breakdown. He was panicking. And of course my response was, "You're meant to be my support person. What are you doing? Come on, help." But he was so overwhelmed, and I will never forget the look on his face in that moment. And I think it's probably because I'm quite an independent person and I've got quite a strong pain threshold, but in that moment I was just like, whoa, what on earth is going on? So you're right.
And so I think, we learn this through our prenatals, but also just on the fly in the birth. And it's a lot of my, this is reassuring the partner, this is good. This is good. This is good.
Do any of them faint?
Have
you had a fainter?
Actually, none of my clients as doula clients, haven't had that. I did have one partner that could not take whatever he was visually seeing, and he had to step out and kind of throw up behind the curtain. The only once though.
Wow. That's hilarious. Like stay at the top end if you can't quite deal with the stuff that's going on down there.
And it was just like, okay, that's just what he needed to do. Like, please don't faint, because no one's going to pick you up, right?
Oh my gosh. I actually remember the look, because with Zarik we had to wait a bit longer in that room because they wanted to come and assess him, because obviously Ishq was born with a genetic condition and they wanted to do it. And anyway, I went into the bathroom and I came back out. The baby was in the thing. What do you call it?
The bassinet.
The bassinet. Oh my gosh. It's late in the day. And I came out of the bathroom and Sabir is sound asleep on the bed. And so I was sitting in this plastic chair with the baby next to me, just kind of like looking at him asleep on the bed. And I'll never forget the midwife's face when she walked in, as if like, come on, mate.
Yes. Our dads do need to be taken care of too. And partners, they are,
partners, no matter what your family looks like.
No, exactly. They, they're up with women overnight, early labor, all night. But they don't have the hormones that's supercharged charging them through it. Okay. So your support people, they do need to be looked after and taken care of. And that is where you can really utilize that third person, a doula, be like, you know what, I can see that you're struggling. I've got her. Yeah. Like, how about you go take a walk, get some fresh air. Like, or just, I definitely have had a lot of dads or partners lying on the floor, like, to go to sleep. And all they need is a little, like, 20-minute cat nap. And then they're up, ready to go again.
Because you're right. They don't have the hormones. They don't have the adrenaline. They don't have, well, they probably have adrenaline, but.
Yeah, they exactly. They probably have adrenaline, but over a long labor, and to that end, I think, let's just quickly talk about that though. Sometimes labors are long. They can go over a matter of days.
And it's not anything you've done right or wrong.
And there is nothing wrong with the labor. It doesn't mean we're in a stall. There's nothing, it is just your body and what it takes to get going to birth your baby. And so can we continue to be patient with that? And so how do we conserve energy? And like, how to conserve energy, Nadine from She Births talks about micro sleeps, that it's important that even in between those contractions, you close your eyes, and those micro sleeps will help ultimately sustain your energy reserve. So if you are, especially if labor happens at night and they're still, even 5 to 7 minutes apart, you can get a good 5-minute nap in there.
Yes, and it all counts.
And it all counts, rather than, oh no, this is labor and now I'm up and I'm
pulling an all-nighter.
And I'm pulling an all-nighter. Like,
how do you pull all-nighters? My gosh, you don't have the hormones kicking in there too. I mean, what's the longest labor that you've had to sit through? Or no, I shouldn't say that. Not had to sit through. What's the longest labor you've supported?
There've been some long ones.
Like days?
One was over the course of 2 days, and we, the labor had sort of pitter-pattered out, so I was able to go home, and then I came back later that night. Yeah. And that was a combined 36 hours or so of, that is a decently long time. But, not uncommon to be anywhere from 18 to 24 hours. And that feels like a long time, but that's all still very much in the realm of normal, especially for first-time moms. So, it just kind of comes with the course, and I have to make sure that I'm hydrating myself, and we've got snacks, and
you're preparing
everybody to sustain. Yeah. So it's really important that we keep those, like, you take care of yourself from an energy reserve standpoint. But also, just, I think most importantly, if you take care of yourself mentally, in that you stay in the positive thinking, and that's where we use the affirmations, the visualizations, and we really leaning into those different things to keep yourself in a positive mindset rather than tipping into a negative spiral. So that's really important, especially in those long labors, because we do ask the questions: why is this long? Why is this easier for some women than others? Why is this? Why is that? And
why am I doing this?
Why am I doing this? And it's okay to have those thoughts and feelings, but can we voice them, and then can we find a way to get back to into the positive thinking and positive realm?
See, I feel like I must be the most uninformed person. No. But look, my babies are all here, and they're beautiful. So, you only know what you know at that time. And I think, having access to people like yourself and this information is just so beneficial for anyone that's due to have a baby, or obviously maybe even your second time around. I feel like you're always learning. So
and we are here to help, and we are here, but ultimately, it's your birth, and you're going to do it. And does a woman need a doula to have a baby? Absolutely not. They have everything. We have everything within us to have our own babies. But in terms of that woman choosing and strategizing how it's going to be best for her, like having doulas in your, choosing a doula to be part of your birth team, will definitely help you get there. I mean, the proof is in the pudding in terms of lower cesarean rates, lower intervention rates, better birth experience. So I think that, but I firmly believe in a woman's ability to have everything they have within them. to birth their babies.
Absolutely. Well, the women that you have are very lucky to have you. Thank you, Lauren. We didn't get an alert to say that this baby's on its way, so hopefully it gives you a little bit of a rest after you leave here before you have to go to the hospital and support another beautiful birth. But I've learnt a lot, and I'm sure everyone else has too, so thank you for sharing your things nobody tells you about labour and birth. That was a wonderful chat. I loved it.
Thank you so much for having me. I love being here.
I know. Well, we love learning from you. So, here's to many more beautiful births.
Definitely.